Only you. We are Dr. Pino in his office, me at home, trying to save on gas because the studio's a little far away. Uh, and you know how these things are lately. Trying to get back to our roots a little bit. Talk about mental health in general, which is, sometimes I wonder if this is a little boring for you, doctor, because it's what you do every day. But I know on my end, um, in my other jobs, listening to people, in particular with the shootings that have been going on recently, always talking about these things as a mental health problem or a mental illness problem. And it strikes me that so many people don't even know the basic difference between what mental health is by definition and what mental illness is by definition. So maybe if you could, we could just start there. What's the difference in the two different things?
Between mental health and mental illness in
Correct.
particular. Okay. All right. So let's try to explain some of the stuff. And it's interesting because my students ask me this all the time. And I'm always trying to help people understand two words, illness and health, right? And we always try to separate those two things between what's normal, what's abnormal.
Hmm.
And the reality is that illness means a lack of health, but it doesn't mean that you have an illness in the traditional sense of the word. So, to understand mental health, we need to first understand that mental health is our ability to maintain our mind and behavior healthy, right? So, when we talk about mental health, we're talking about something no different than physical health, meaning we want to maintain a balance of our physical health, part of which is mental. Now, traditionally, we have separated health into physical and mental because of the history of behavior, right? And because we always thought of mental as something, I don't know, magical, as something strange, as something that it is mysterious. But the reality is that when we talk about mental, we're talking about the brain. At the end of the day, the brain is the most important organ when it comes to behavior.
Hmm.
And actually is the computer of everything else that happens in your body. I mean, every single function that has to do with your heart, your kidneys, your liver, your hormones, your motion, everything is regulated by the brain. So at the end of the day, when we talk about mental health, in reality, we're specifically talking about the health of the brain. And the health of the brain comes in three levels: biological, psychological, and social. So just like we exercise to maintain good fitness and muscle and low fat, we have to think of the brain as an organ that requires that we maintain health, right? Because at the end of the day, the brain is going to manage everything. I mean, go ahead.
So how does one keep a healthy brain?
Well, you keep a healthy brain by doing some very basic things, right? You don't stress, you
Hmm.
sleep well, you eat well, you're well hydrated, okay? You don't have sudden changes up and down um, of your weight, and then you avoid inflammatory processes. I mean, and again, I would tell you exactly the same thing if it was how do we maintain a healthy body, right? Well, they're basically the same things. Now, when it comes to the brain, though, there's two parameters that are particularly important. One is sleep, and the other one is uh, the fact that you need to maintain a healthy diet. Now, a
Hmm.
healthy diet would be a diet that facilitates recovery. Now, the brain is not a static organ that it has switches that go up and down. It's a very dynamic organ. And stress is the single most damaging thing that can happen to your brain. When it comes to longevity, when it comes to prevention of illness, when it comes to a number of different things, because stress kind of facilitates inflammatory processes. when
And
inflammatory
specify what
process.
that means. What is inflammatory? People hear of inflammation. It's something that happens, when the weather changes and you hurt something. But how does that relate when it comes to your neurology?
Well, if you want to understand that, you need to understand what happens when you're scared, right? Let's assume that you are walking out of your office and there's a lion waiting for you to eat you, right? So you're gonna get into a fight and flight response. A fight and flight response is a response you have to protect yourself, right? That is a short-term stress reaction, right? That is going to make you run. It's going to make you protect yourself. It's going to make you very acute with your eyesight. It's going to make you not producing the saliva, so you don't choke on it when you're running. You can't pee or poop when you're under acute stress, right? So you're ready to run. Okay. What happens after you run and the danger goes away? Then your body is inflamed, meaning your joints, okay, your heart rate. So the body starts producing hormones to de-inflame the body, to decrease the inflammation of the body, and those are the steroids, right? Okay. What happens when you have a chronic inflammatory process, for example, an autoimmune disorder, rheumatoid arthritis, uh, problems with MS? What happens is that the body starts reacting as if you have inflammation all the time, and it starts producing a stress related anti inflammatory hormones to decrease the inflammation. The problem is when it comes to chronic stress and chronic inflammation, those hormones are there to reduce your inflammation, do more harm than good, right?
Mm,
So, what happens? You start storing fat, you start having problems with the ability of the brain to repair itself, you get fatigued. So if you think about the inflammation that happens when you get a cold or a flu, let's say the flu, and you think about how you feel tired, you feel fatigued, because your body is responding with antibodies, right, to attack the inflammation, and then your body's going to react to that, right, to reduce the inflammation. So the reduction of the inflammation causes side effects.
mm,
If you're chronically stressed, your body's always acting like if it's inflamed, right? So then you have the chronic fatigue, the worsening of depression if you have the genetics of depression, the lack of motivation, the lack of interest. So having depression, which is one of the mental illnesses that we frequently talk about, is like having the flu without a fever. So a lot of people will argue that depression is also an inflammatory process.
So really, the key issue is to make sure that lion's not chasing you 24 hours a day, finding a way to get away from it so that we don't have that physiological response that puts us into that mode of being inflamed, and thus those hormones are being released to affect us negatively. So how is that distinctly different? And again, making the analogy to the body, I didn't get a lot of sleep last night. That's actually a pretty good example, and I'm feeling a little run down today. But that's a maybe a little sickness or a little thing. It's not actual illness. It's not necessarily chronic. What is that distinct difference between uh, a mental illness versus just somebody who's having maybe a bad day? Because that line can come in many forms. But what's the distinct difference that really defines that?
Well, when we move from health, which is everybody's responsibility
And we all have that,
individually,
and we all
and
deal
we
with
all
that.
have that.
Yeah.
When you have certain parameters in your life, some of which are genetic, meaning mental illness runs in families, right? And you have had exposure to either stress, abuse, or neglect during your childhood, right? Or you start putting substances in your brain that you're not supposed to, like drugs of abuse, excessive alcohol, then you are changing or awakening a genetic predisposition to something. A good example is diabetes, right? Most people have diabetes type 2, don't develop diabetes when they're born, but they have the genetics of it. And depending on what they do with their life, in terms of their weight, their exercise, the healthy things you're supposed to do, you may get the diabetes sooner or later. It can also be precipitated by other illnesses, lots of infections, urinary problems, kidney problems. They may facilitate you getting the diabetes sooner. So even if you have the genetics of diabetes, there's certain things you can do health wise to prevent it from coming to you too soon, right? The same thing happens with the genetics of anxiety, depression, psychosis, bipolar disorder. You may be born with the genetics for those disorders that are complex, but depending what happens with your life, you may awaken it or not. There's some exceptions though. There's some illnesses that are very traditionally manifested very early. For example, attention deficit disorder. If you have attention deficit disorder in one of the parents, it's very likely that one of the children, or at least half of the children, would have attention deficit disorder. And that doesn't require that you neglect or abuse or stress your kids. It's just how the brain is wired. So there's some disorders like autism, like ADHD, what we call the neurodevelopmental disorders, that you're born with them and then they're going to manifest based on a number of factors, including your temperament, which is also a biological issue. But if we take it back to mental illness in terms of the traditional illnesses, um, like most illnesses in medicine, there are a group of signs and symptoms that come together, that we lump them together, and then we say, you have this disorder, right? We don't know everything, right? It's like with diabetes. We know when somebody has diabetes because the blood sugar goes up. But how it happens is tremendously complicated, because diabetes type 2 is not about the pancreas, it's about the muscles not utilizing sugar properly, right? So the sugar goes up. Actually, initially during the type 2 diabetes, people have high insulin levels, not low, because it's not being utilized properly. But all of that said, most illnesses in medicine that we call illnesses are actually more syndromes, a group of signs and symptoms that come together. So we take the illness of depression. How do we separate that from being sad, right? So the reality is that in the illness side, and this affects probably one of five people in their lifetime, you're gonna have episodes of time where you're gonna have lack of energy, lack of motivation, lack of interest, feeling lonely, feeling fatigued. You don't enjoy anything that you do. You start having thoughts that everything bad that happens in the world is your fault. You sleep too much, you sleep too little, you eat too much, or you eat too little. When you put all those symptoms together, we said that is depression. It has to last for a period of time, and it has to cause dysfunction, right? Meaning it's so severe that it keeps you from interacting with other people, it keeps you from going to work. So it's a very disabling illness. Actually, depression is the second largest cause of disability in the world,
Wow,
right?
that's
So
incredible.
it's a pretty common disorder, it happens a lot, and it's hard to identify. One of the problems and the uh, myths and facts related to mental illness, like depression, for example, one is most prevalent, not the most prevalent, we'll talk about that in a minute, is that probably um, people start thinking of themselves when they're depressed as something being wrong with them as humans, right? There's something defective about me. I'm not good enough, right? And then you start having difficulty in shame about letting people know how you feel. So there's a natural rejection of trying to get help until things get really bad.
And
Now,
that's where the social aspect comes in, correct?
yeah, because you become socially isolated, you become very negative about yourself. And if you stay in that state of mind for a long time, it becomes actually chronic and difficult to deal with.
So the triggers is the environment affecting your predisposed biology. So like as you mentioned, the and by the way, I'm editing a section of a book speaking exactly about that right now.
Mhm.
But if someone has that predisposition to diabetes, type 2 diabetes, it can click on. Is it curable or is it just manageable at this point? Once it's on, is it on? So if once somebody develops bipolar depression, they will have it for the rest of their lives. It's not something that goes away. It's not episodic. It's chronic.
No, it is actually episodic. Actually,
Interesting.
in the definition of bipolar depression, it is required that you have periods of normalcy in between.
Okay, well,
Because
one of the other not specifically that one, but
the same
uh,
with depression. I mean,
okay.
most people with depression may have one episode, but they're always going to be at risk for another, right?
Got
So what happens is people always ask me, so if I have depression, how long do I have to take medications? And I always like to say, if this is your first episode of depression, intense, severe, disabling, I would recommend you stay on medications anywhere from 9 to 12 months, and then we can discuss the risk of not taking medication, right? Because I've seen a lot of people who stop taking medication. We continue following for 1 year, 2 years, and they're fine. Okay, but there's other people that something happens, whether it's biological, psychological, or social. For example, a classic would be a woman who had depression, was 23, gets treated, gets better, gets married, and has a child at 29 and gets bad postpartum depression, right? So we have to recognize before she gets pregnant that that person is at risk of having depression again. We have to recognize that younger people who have had episodes of depression and start using drugs, then they also end up with situations that makes him more at risk. So we have to identify people at risk early and start working with them. But now, if you have had two or two or three episodes of depression in your lifetime, I really recommend you stay on medication for a long period of time.
So, but it's not curable. It will always be there. The risk factors will be there. So it's not something that can go away. I think you mentioned this before. Unless you can cut it out with surgery, kill it with an antibiotic. And I apologize. My studio just got raided by some friends, and
I
so,
love that. I love
yeah.
that.
So, but it can't really be excised, right? So once that occurs, so mental health is something you all deal with. We deal with it every day. Your dog has an issue. You get depressed. That's sadness. That is an episodic level of depression that could be so extreme that it would be considered clinical. Then there are people who are guaranteed to have recurring episodes because they actually have an illness that predisposes them to that. Is that more accurate?
Well, part of the problem with the definition of cure, and I always go back to diabetes because of the parallels, is that we don't define cure very well because cure means you don't have anything anymore. So most illnesses in medicine, including psychiatric illnesses, are manageable, right? But the question is how, right? It's not if, but how. How do we go about helping somebody maintain balance and health? And that's true for health in general, and is particularly true for health in mental illness. And the reality is that health is a balance, it's not a flat state. So you don't cure by eliminating the illness, you balance by facilitating good functionality, meaning you have to take biological, psychological, and social tools to help somebody regain their health, not to cure the illness. Because we could be talking about MS, we could be talking about somebody with diabetes, or somebody with epilepsy, or somebody with a lot of those chronic illnesses that some of them are cyclic, some come and go, in which we shouldn't be just focusing on what pills do I give you so you can stop having symptoms. But if my medications help you reduce the symptoms, what are you going to do psychologically and socially to maintain your balance? So, if we were talking about diabetes, you go to the family doctor, endocrinologist, they give you insulin or some of the newer medications for diabetes, but you still have certain responsibilities. You have to follow a diet. You have to exercise. You have to live a healthy life in terms of not excessive alcohol, not smoking. So, if the idea is functionality and longevity, then two-thirds of the work is not what the doctor does, it's what the patient does. But
So,
sometimes we forget to give people options into what to do.
Well, also in our society, we're just give me a pill and that handles it, as opposed to taking some personal responsibility. So difference there between mental health and mental illness. Mental health we all deal with. Illness can be something chronic. It's persistent. It's pernicious. It can come and go depending on which mental illness. To that point, how prevalent is this, and what different types of mental illnesses are there?
Well, you can actually track this based on, and we actually have developed guidelines diagnostically, which are kind of challenged all the time, based on the cluster of symptoms the patient is manifesting. So, for example, we have anxiety disorders, and there's a multitude of them. We have mood disorders, which includes depression, mood disorder caused by drugs, bipolar disorder, and so on. Then we have thinking disorders, meaning disorders that have to do with your perception of reality, right? Whether is what you think is real is not real, or you start having unusual experiences like hearing voices, seeing things. And then you have other disorders that are more dissociative and trauma related, like PTSD and some other dissociative disorders. And then you have uh, kind of other disorders like OCD, and then you have what we call personality disorders that I don't think they're disorders, but they're labeled as disorders. They're more problems of intensity and frequency and predictability of your behavior based on the patterns that you have developed of behavior like narcissism and antisocial person and so on. So if you want to think in terms of the types of illnesses, well, they're basically symptom cluster. The problem is, and this is what our diagnostic criteria gets challenged, is that you can have a multitude of symptoms or have what we call comorbid condition. Like not infrequently, you're going to see somebody has major depression that also has generalized anxiety and social phobia, and somebody has depression with psychosis, and people have bipolar with psychosis. And then you have to wonder, I mean, is that a one disease or there are multiple diseases that the patient is suffering or different parts of the brain? So there's a lot of motion in terms of science trying to focus more on the functioning of the brain because we've done it backwards, you know. We say somebody's anxious, so it's got to do with the brain, but we don't know exactly where. Then we start looking for places. And in reality, most illnesses are multisymptomatic. You can have a disorder that has to do with the frontal lobes. And you have other illnesses that are more pervasive and traditionally manifested like neurodevelopmental disorder. ADHD, for example, is a very biological disorder that is gonna be kind of backwards. It's gonna be impacting your personality because of you having attention deficit disorder. So your behavior is gonna be um, kind of contaminated, if you may, by the attention deficit because of the lack of impulse control.
And how prevalent is this? I mean, I see people all the time, and we all meet people and say, "Wow, I think there might be something going on here." And it seems like everyone has something a little bit, but that's mental health. How many people out there are really walking around with a persistent mental illness, a diagnosable mental illness that should really be seeking treatment?
Probably 1 in 20 Americans will say
Wow.
are going to have some form of a serious mental illness, and that is classified as people that have major depression, bipolar disorder, schizophrenia, schizoaffective disorder. But if you think about symptomatic disorders, it's a lot higher. Um, it is believed that 1 in 5 Americans will manifest symptoms enough that could have a diagnosable disorder. And the most common one by far is the anxiety disorders, right? Generalized anxiety, panic disorders, social anxiety. That you're looking at probably 20% of the population at a certain point in their lives are going to have symptoms of that. And what happens is that anxiety disorders are manifested by excessive fear, right? I mean, you're afraid of something all the time and you're worrying about something all the time. So it comes in different flavors, if you may.
And 1 out of 20, that's a lot of people.
Yes.
That's a lot. Um, and if that's so prevalent, why do we have this consistent and persisting just mentality toward mental illness that it's always somebody else, it's always severe, and a lot of people I'm sure that you see are pretty hard to accept their diagnoses. Why do we have such a bias against mental illness when it's so prevalent? I mean, we don't persecute people who have diabetes. Why those with mental disorders?
Not right now, but you need to understand there's a history behind this. There's a process that has been going on for centuries, in which you're able to recognize those who are different and that behave differently as being outside of the norm, right? And I'm saying using that term because one of the most difficult things in mental health is we never define normal, right? There's no definition of normalcy. It's a wide range. So when you start getting to the edges of what we consider normal or normalcy, then we start thinking of people as being different. And we have this natural tendency to reject different, right? I mean, we're in the midst of that, politically speaking, if you may. So we have to deal with the fact that if somebody's different, we have a natural tendency to reject them. We're not empathic to people who are different to us. We're not naturally inclusive, if you may. Then you have issues related to tradition, right? For example, it wasn't, I don't know, 60, 70 years ago that we still thought in a lot of places as people with epilepsy being mentally ill,
Mm,
right? And a lot of people with epilepsy ended up in the state hospitals. So we get back to the issue of the brain. So we have this tendency to look at this as something magical, weird, under somebody else's control, right? Then we have the issue of shame. We don't want to be identified as being those different people. So when we talk about mental illness, immediately in your mind it comes a schizophrenic, untreated patient who's homeless, talking to themselves on the streets, in the middle of Phoenix, 120 degrees. And you said that person is really weird. So when you lump those people with you being normal, so I don't want to be like that. So if you tell me I'm mentally ill, you're telling me that I am like that. And that is one shameful and unacceptable. And then we have a history in the 1900s in which we got lost. We got lost into the analytical world of explaining all behaviors by psychological means, right?
mm,
It wasn't in the latter part of the 1990s, I mean, the 1900s, when we started really looking at sociological factors, biological factors. I had the fortune of actually getting education in all three: the analytical background, self psychology, Freudian stuff. I was in training in the midst of the brain revolution in the 1980s, and then I got a lot of the social background in terms of the importance of understanding social behavior and not only individual behavior. So in that sense, I think that there was this kind of elite attitude about those who knew about mental illness being at a different level,
kind
right?
of like the physics, right? With science. If you're a physicist, all of the scientists look at you differently.
Yeah, so we got mixed. We actually got confused between being neutral and being aloof, right?
Gotcha.
And I think that there was this kind of narcissistic, cultural knowledge attitude of those in the analytic world that they understood some things that the rest of us mortals didn't,
Gotcha.
right? So that created kind of a magical, you know, psychological and kind of rejecting feature on the rest of the world, saying we don't want to be part of those guys. They're weird to begin with,
Hmm.
right? And that's still going on. I mean, psychoanalytic theory is still very active, but there hasn't been any demonstration that analytical theory by itself helps any particular mental illness.
Hmm.
You know,
So was that the opportunity you think as well for the pharmaceuticals to really slip in and that that spot where people were, uh, admiring themselves and their knowledge, and so it was okay. We'll just throw it into the pharmaceuticals will come in and take over, or was that part of a different aspect of the development of psychiatry?
Well, that was part of the evolution of psychiatry, and we're still in the midst of that. Um, but let me just give you one fact: the medications we use today, okay, for depression, for anxiety, for mental illness, is still being based, okay, in a theory that was developed in the 1950s.
Wow.
So we don't have a lot of new things in psychiatry, like new mechanisms of action. We know a lot more about the brain, but we're still dancing around serotonin, norepinephrine, dopamine, ACTH, right? So there's some attempts because I do some research of getting deeper, right, into other things that may help us understand the illness better and provide better treatments. Because we don't, I'm going to get in trouble for this, but I'm going to say it anyway. I always get in trouble. We don't have any particular medications in psychiatry that treat any particular mental illness. We have medications in psychiatry that reduce the intensity of symptoms of mental illness. That's it. And we're still based on the same theories that were developed in the 1950s, right?
So what's the next step? Where do you see this going?
I think that there's some very fascinating things that people are going to be very excited about. I think that we're going to start exploring the mechanism of action of psychedelics, issues like ketamine, psilocybin, LSD. We're really getting into trying to understand, is there a therapeutic value to those drugs besides getting dissociated and getting into a trip? And the answer is looks like it's yes. But that is opening the door for other medications that may impact the same mechanism of action.
Hmm.
So we're starting to be blinded by the idea and that we know a lot, right? So these times, I think, are times of being humbled in psychiatry by what we don't know, and to help people balance their lives in a way that they can be happier with themselves, more content with their lives, okay, and to understand that this is not about fixing anything. Okay, and we're going to talk more about myths and facts in the future. We're going to talk about kids, but I think it's very important that people to understand that the first step toward good mental health is recognition of what you're trying to do, which is you are all you have, hence the only you. You're going to be with you forever, and you need to be responsible, okay, for learning to manage your uncomfortable feelings, whether it's with medications, therapy, social rehabilitation, risk taking, whatever you're going to do to help yourself. You have to do it for the right reason. And is that if you don't know who you have nothing.
Um,
You're at the mercy of the world, chronically stressed because somebody didn't give you enough likes on Facebook.
Well, hopefully, as we move forward with all this and discuss, hopefully, a little bit more about those options, I think ketamine in particular is very fascinating. I know people who take it or use it, I should say, and again, not recreationally. This is under controlled medical application. Some of those new things, because I think people are looking for relief in other ways. Of course, on the other end of the spectrum, you have the guys doing the ayahuasca, the DMT, and things like that. But is that part of that impetus to start looking at alternatives?
Yeah, I mean, in the research group that I work with, we're actually looking at getting license from the FDA to do some research and level what we call class one drugs, which is drugs that traditionally have been considered of abuse. But that is already happening. It's happening in Canada, other parts of the world. If you look at the National Institute of Mental Health in the United States, there's a lot of excitement about ketamine and psychedelics. So not necessarily because we want the drugs to be used, but because we want to understand how they work.
Okay, well, sounds like another topic for a different show. Thank you once again, doctor, for chatting to us about that. I think it's important for people to know the difference and start looking at their mental health much like their physical health, taking some responsibility, and go out there and get diagnosed if you think you have something that might be more acute. Take care of yourselves, and we'll see
Yeah,
you
we'll
next
see you
week.
next week. Take care, man. Bye bye.